Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you've tuned in to another episode of my virtual global clinic. For those new to the channel, welcome. I specialize in the removal of cysts and lipomas, and I've created this YouTube channel to showcase the work that we do in clinic. Really is to educate people at how simple and straightforward it is to remove these quite disfiguring and sometimes harmful and complicated skin conditions. So if you think that you've got a cyst or a lipoma and you'd like to get it removed, then obviously do visit me on my website, lipomacyst.com, your one-stop shop for all lipoma and cyst removal treatment. If you want some more educational information and some merchandise, then do visit drkhaledsadek.com. For those of you who are active on social media, remember I've got a Facebook page, I've got a Twitter page, I've got an Instagram page. So very easy to find me, drkhaledsadek.com. And throughout the week, we're going to be releasing some material about the videos that we've got forthcoming, a little bit about the day in the life of myself, what we get up to in clinic, the local area. I know a lot of our viewers are international, so I'll show you a little bit of the local area, and you can see that on Instagram. We've got some good news. In October, we've got Lipoma October. That's right, a whole month dedicated to lipomas. So Lipoma October. Remember we had the Face Cyst series last month. In October, we're following up with Lipoma October. And those of you on Instagram would have seen, we're going to be kicking it off big time with a massive back lipoma. Probably the biggest you'll see, probably the biggest, best, beautifulest, smoothest removal on the internet. So that's coming up in October. Remember, Lipoma October, put it in your diaries. So the virtual clinics, we're running every Wednesday, Friday, and Sunday, where we discuss a topic of your choice. So if you message me, either directly via Instagram or in the comment section down below, we'll be raising some of those topics. We've had a lot of suggestions. We've covered coronavirus and shielding, how to wash your hands in coronavirus. We've done thyroid disease, so hypothyroid, hyperthyroid. We've covered goiters, Hashimoto's, and Graves. We've covered osteoporosis, osteopenia. We've covered rheumatoid arthritis. And today we're going to talk about gut disease. Well, that's right. We're going to talk about poo, or basically your bowels, and what they should and shouldn't be doing. A lot of people have been writing in on the Instagram asking me to cover bowel probiotics and bacteria. So we're going to be doing a little bit on bacteria in the gut. So if you've got some questions, put them in the comment section. We'll also be talking about the video that we've got coming up and the video that we've just had. So let me know what you thought of those. So we've been running a little bit of a puzzle, where we're sort of trying to get some word game going, get some nice names for these cysts. We had, for the bra strap, we had the Bravo cyst, which was one of my favorites from Australia. Someone suggested we call it Dave or Cysty McCyst face. Yeah, so we had those suggestions. In the last one, we had a cyst on the back of someone's thigh time, or thigh in the sky. Lots of high thighs wordplay there. So the next one, it's on the back. It's on the back, and it's going to be released straight after the live chat. So you know the routine. We'll do the talk, we'll do the shout outs, and then we'll go to the premiere. Remember, premieres every Wednesday, Friday, and Sunday. If you're not subscribed, hit the subscribe button, press the notification button. And 25 of you have lost your fingers because I can only see 24 likes. 24 likes, what's going on? Let's hit the like button. By hitting the like button, that tells Instagram we support Dr. K. And that means they'll push our videos further ahead of our competitors who are always trying to sabotage our live chats by releasing videos only an hour before we go. But that's not a problem. We're going to still proceed. So let's talk about guts. Now, a lot of people are interested in what is now known as the more bacterial DNA in your gut than there is your own DNA. So that kind of tells you the kind of relationship that you have to live with. So you've got all of this foreign organism in your gut, far more than your own DNA. So we have to address it. We have to find out why it's there. We have to nurture it. And the best way to think about gut flora is to think of it like a lawn, a nice grassy lawn. And what you want to see is a nice, flat, even Wimbledon tennis court lawn or a golf course lawn. What you don't want to see is patches of abnormal growth of grass here and there and some weeds. You don't want that. And that is really what's happening with your gut flora. You know, what we want to see is a balanced colony of all of the bacteria living together. But where we find one colony growing faster than another is where we start to have an imbalance in our gut flora. And so one bacteria will take precedence. It'll take all the food away from the others. And in this process, will produce gas, bloating, constipation, diarrhea, and lots of other issues as well. So we've got to feed it the right food. And this is where things like probiotics, prebiotics come in. And you can get bacterial supplements from your local pharmacy or drkhaledsadek.com. And so we have to feed the gut so that it grows a nice, healthy shade. But we also have to make sure that we kind of trim it, but not too much. And we're all very guilty of consuming foods or products or liquids that will basically wipe out your gut flora. And the most common of those is alcohol. Alcohol is a disinfectant. We use it to clean the skin before we operate. And needless to say, if you drink alcohol, you'll wipe out the gut bacteria in your tummy. And you'll end up having bloating and constipation and diarrhea. So once we've got the gut flora perfect, and by no means is that easy, we know that if it is perfect, we can live longer, our mood is better, we're able to concentrate better, reduce our risk of infections, reduce our risk of cancer, we're able to absorb better food. So we really have to think about our gut flora. We always have to kind of tune in. Well, it's an S, it's a syndrome. We've spoken about syndromes in the past. So that's irritable bowel syndrome. That's to say, it's not a disease, it's a collection of symptoms, but with no sort of underlying disease. IBD, that's inflammatory bowel disease. That's IBD, inflammatory bowel disease, and that is a disease, and by its nature, it's caused by inflammation. So we spoke about inflammation in the thyroid disorders. We spoke about it in Graves. We spoke about it in Hashimoto's. We also touched base in rheumatoid arthritis, and we spoke about how antibodies and autoantibodies will initiate a flare-up in either of those conditions. And we also spoke about lichen planus as well, and how that is antibody-mediated as well. So the inflammatory bowel disease are very much the same. And of those, you've got Crohn's and ulcerative colitis, very similar, but also subtly very, very different. But in essence, you'll end up getting a lot of complications of those: increased bowel motions, blood, diarrhea, that kind of stuff. So on the one hand, your IBS is really focused around diets. And one of the diets coming out that's really popular is something called the low FODMAP. And FODMAP is spelled F-O-D. It's like food, but missing an O. So it's F-O-D and then map, like roadmap. So it's FODMAP diet. You can Google it. And it basically tells you about foods that will take longer to transit the gut. And the longer they're in the gut, the more they're kind of being broken down, the more they're fermenting and producing horrible gases, which will cause bloating and distension. So if you can identify the high FODMAP foods that you're consuming and push those to a side and increase the low FODMAP diets, you might be able to solve some of the symptoms that you're getting with the IBS. And in terms of probiotics, people always ask me, what do I need to have? Well, listen, there are two forms of probiotics. There's the stuff you get from the chemist, and it's little capsules. You pick it up and you have one and you swallow it. And there's another one, which is a live bioculture. And that means that the actual bacteria is alive in a medium, usually a yogurt. So what is the benefits of one over the other? Well, the benefit is often price related. So the stuff off the shelf tends to be a lot cheaper than the products you can buy from a chemist. Like once you've added water to that bacteria, how much of those bacteria will actually still be alive, and therefore the bacteria that goes into your system is an unknown quantity. So that's the problem with probiotics off the shelf. Probiotics over the counter in a fridge, well, these are products where live culture bacteria are actually in the drink. So therefore, they need to come out of the factory on what we call a cold chain. That means the transport has to be at a certain temperature, the storage has to be at a certain temperature, and that temperature needs to be maintained throughout the consumer manufacturer pathway. So if some reason someone leaves it out for a couple of days in the sun, it's not going to be beneficial for you. And so when you buy it from the chemist, you need to put it into the fridge. And often with these products, they'll come with cooling packs. So obviously that cold chain is a logistical nightmare, and nightmares mean more money. So the products over the counter in terms of the live culture tend to be a bit more expensive, but they are really, really good. So if you've got IBS, I do recommend investing in some VSL or Simproof, or just some yogurt, to be honest, with some bioculture in there. But if you want to go for the capsules, that's absolutely fine. The manufacturers know that a certain proportion of them won't be live once you consume them. So they pack it with billions and billions and billions of bacteria. So on the bottle, it will say billions and billions of bacteria, because they know that over time, those bacteria live concentrations will diminish. So that is in a nutshell a bit about the gut. Let me know if you've got any questions. Let me know what topics you want covered for next time. Remember, we've got Friday and we've got Sunday before we hit the Lipoma October. Let's see who we've got in the house. Let's say some hellos. Let's scroll right up to the very top. You know what we do? We do the podium. Sherry S. Welcome, Sherry. She's been sending me some lovely photos of her socks. I think I put an Instagram picture of my aubergine yellow socks. Very, very popular. And it's caused a tidal wave of sock pictures, which is awesome. Send me your sock pics. Marion from Marion, you're from Scotland, I believe. She says, "Hi, Dr. Sadek and friends. Hope everybody is well. Welcome." Anne Brooks, she's wishing everybody well. And in at number 4 is Alessandra from Sao Paulo. Welcome. Gail States, Georgia, United States. That's Rhonda Burke. Louise Cook, hope everybody's having a good weekend. Margaret Brace, Dr. Sadek, do you have any opinions on prolotherapy for arthritis? Is that the injections of synthetic collagen? Let me know. Louise Cook has hit the like button. That's what I like, Louise. Taking the initiative to hit the like button. 62 viewers, 37 likes. Hit the like button. It's just up there. Look, can you see it? Bing, bing, bing. It's 38. Let me see. Bing. Can anybody else? Bing. Press it. Bing. We'll see. Who else we got? Kelly from Connecticut. Welcome. Trigeminal nerve neuralgia. Sherry is demanding information on trigeminal nerve neuralgia. Absolutely, we'll get some of that on there as well. Stacey Donnelly. Hello, everyone. I must say, it's neat to see so many people connecting here from so many different places. Dr. Sadek bringing everybody together. So thank you so much, Tracy. Kelly saying, "Hey, Doc, how are you doing?" Let's scroll through. Let's see who else do we have. Has everyone seen Doctor's socks? That says Sherry. No, Sherry, they haven't. We'll put them on Instagram. Absolutely. Let's scroll. Maybe we can make a contest of socks. I have one perfect cosplay ladybug. Well, you know, post it through. Why not? Let's do it. Let's do a let's do funky socks. Let's do funky. You can do one of those things, those viral clips things. Denise Bonk says, "The socks are starting to sound like a book. Where are Doc's socks?" Yeah, it's like, where's Wally, but where are the socks? Where are Doc's socks? Well, look, I'll try and keep you posted with more socks on the Instagram. Margaret says, "Dr. Sarah, I tried making Turkish coffee. Watch your demonstrations again and must practice my technique." Well, look, Dr. Sarah, our resident orthodontist, she's in the house. She's taking questions. I know you guys often do like to ask questions about your teeth. She's also got her own YouTube channel and she's doing live chats. So, you know, catch her on her Instagram, check her out on her Facebook page. She's got, I think, 7,000 followers. So she'll be updating you on her live chats. There's Sue Lally from London. Welcome, Sue. Dr. Sadek and everyone watching the virtual global clinic, welcome. I used to get scolded for wearing unusual socks to work, says Anne. That's not nice. Well, what kind of socks were they? North Carolina, hope everybody is doing well. Laura Marino from Milan, welcome. Ciao, Doc. Ciao, Laura. How are you doing? Jen Norbury, welcome. Prince of Zam. Hi, Dr. K from East London. Prince of Zam, as you all know, is the man behind the cam. So we're trying to get him in front of the camera, but he's being elusive. And if he does, he'll probably wear a mask. Carol Hess, happy to watch you again from Austin, Texas. Awesome, Carol. Thank you so much. So much love from the United States. Praying for everybody affected by the fires in Oregon, California, COVID, all around the world. Stay safe wherever you may be. Caroline Tom from Wales. Welcome, Wales. How are you doing? Let's have a look. Let's scroll through. Let's see what's we've got. RS, just the initials RS. Wishing everybody a wonderful time. Christiana, lipoma October. As a Brit would say, lipomar, October. I don't get that. In Italian, Laura's written, she wants anatomy presto, quick anatomy, medical anatomy. Translate it for me, Laura. Someone translate for me what Laura has written in Italian. Cecilia Schwartz, welcome. How are you doing? Can you please make lipomas pop? Lipomas pop. Well, listen, we take the lipomas out, delicately and safely, and the videos are there to educate everyone, to show them how easy it is to get these quite disfiguring skin lesions removed. So really is kind of my global mission to get people to come in and say, well, actually, Doc, you know what, that cyst's only been there for a week. So far, we're still on like it's been there for 7 years. It's been there for 3 years. I want to be in like months, not years. So we've still got a lot of educating to do, and that's what these videos are for. So they are fun, but they're educational. They have a purpose for them. Lena from Madrid, welcome. Hello, hope everybody is keeping safe, wearing masks, keeping social distance, and washing their hands in case of a second wave hitting the United Kingdom. That's Sulilali, wishing everybody that they are safe. Someone, a wonderful Brazil turnout today. KP 2010, I missed the RA. So look, the rheumatoid arthritis video, it was not the last one because that was the lichen planus. It was the one before that. So go back and check it, read it, take a look. Dr. S, could you please comment on scalp dysthemia and nostalgia paresthesia? Okay, I will take a look at that. It's not a topic that I'm well versed, but I'll take a look. Why not? How about mental health, says Kelly. Look, mental health is coming up a lot. So why don't we do Sunday's chat on mental health? But which aspect of mental health? You need to tell me. So it's so broad. It's like saying, let's do cardiology, but like which aspect of cardiology? So I guess for the large proportion of people, it will be what we call common mental health conditions. So that's anxiety and depression. So, and panic attacks, those kind of like low level, as opposed to serious complex mental health. So that's the schizophrenia and the borderline personality disorders. So we can cover mixed anxiety, depression disorders. Absolutely not a problem. We can cover that if that's what you mean. From Mexico is M. Hello from Mexico. Welcome. So backhanded. What does that mean? I don't know. Tell us about gastroparesis, says KP 2010. I will do. Mrs. Jackson, welcome. Donna Adams from Oklahoma City. Sid G is saying hello to everybody. Mimi Newell, hello, Dr. Khaled and everyone else. Mimi from Alabama in the good old United States of America. My husband is suffering a lot from stomach issue. Glad you're talking about this. Mimi, tell me what stomach issues he's suffering from. Margaret Brace, all of October, I would love to see lipoma fly across the room. God. Oh, well, I don't know about that. Hope you're well and keeping safe here. As you know, the coronavirus rate is high. At least the warm weather is nice, warm and sunny. That's from Luna, absolutely. Yogurt is good for the gut. I think it says for the gut. I love Greek yogurt. I also heard that vinegar is good. So that's from Susan Burt. Remember, my videos are... we definitely want to see weeds. Okay. Glad in September we have cysts. Any more on their way, says Alessandra. Yes, absolutely. We will send some more. We'll send some more. GERD. Absolutely. So Ms. Jackson's writing about GERD. So that's, gastroesophageal reflux disease. Saw your sister on her channel. She's as beautiful as she is smart. That's Donna for Dr. Sarah. Let's have a look. Could you comment on gastric bypass and digestive issues? Also, do you recommend probiotics? Louise Cook, absolutely. I think I answered that question. Nancy Hornbrook from Maryland, United States. Nice live chat. Very informative. I'm having trouble buffering, but it's only on this channel. I think you're right. I think my internet's a bit weak around peak time. Nora Holton. Homemade kefir is a good probiotic. Absolutely is. I don't know how you homemade it, but kefir is a wonder drug. It's a superfood, isn't it? Bambai 2009 is saying hi. Welcome, everybody. Let's have a look. Sid G. I like plain Greek yogurt with live bacterial culture. Absolutely. My heart also bleeds for the EU. Natural disasters plus the coronavirus. That's Luna from Madrid. Absolutely. Laughing out loud. That's wonderful. Let's have a look. Hi Doc, a question please. Tell us the name of the building appearing before the virtual clinic. Well, that's Eagle-Eyed Sulalali. She spotted a rather beautiful red bricked with some Italian facade, and that is the Victoria Albert Museum. There we go, over in Kensington, opposite Imperial. We'll do some intros once it's open. We'll go in and we'll film, and I'll show you that museum inside. Absolutely beautiful. Peggy Stephan, she's interested in neuralgia. She wants a bit more information on that. The smoke from California has reached us, and Sid G lives in Ontario, so that's a long way to travel. Dr. Laura wrote that she's got a great mark in anatomy and that she likes to become a doctor like you. Thank you. Okay, well look, congratulations on sorting out the anatomy. I think if you've got the anatomy nailed, then really everything else falls into place. Well done, Laura, and thank you. Okay, love your live clinics. They're very informative. Cheers, Curly. 4575 from the Isle of Man. Honey Buns, welcome. Okay, Belinda from Cologne, do you remove more cysts or more lipomas, or is it 50-50? I think if you watch my channel, you'd probably think that all I do is remove cysts. It's more like probably 90-10%. I think we're 90% lipomas and 10% cysts. But I haven't done the maths. I haven't done the maths for it. But I think it's more lipoma heavy. Let's have a glass of water. Definitely we do more lipomas. Like we have to go through maybe 25 cases to get you like 2 or 3 videos. So it's like lipoma heavy. Yeah. Sulalali, would you kindly share the global virtual clinics on your Facebook to help your friends? Nice suggestion, Sue. Absolutely. Like if you've got the link for the YouTube, then stick it onto your Facebook. Let's hit 50 likes, because we don't get 50 likes, we're not going to see that amazing pop. Marion is agreeing. Thoroughly enjoying your clips here in Houston. That's Doral King. Thank you so much. Justin, hiatus hernia. Okay. We'll have a look at hiatus hernias. For me, all medical topics are welcome. I never thought I'd need to learn so much in this field, even not being in a medical field. Well, look, Alessandra, it's like you're in med school. Mental and physical health under COVID-19, anxiety, depression, loneliness, and postponing medical tests. Louise Cook, it's a big topic. And part of the ramifications of the massive lockdown is an increase in mental health issues. So we will cover all of that, absolutely. Princess Anne, bit later for a mug of tea. It's just water. It's just water, guys. Curly, Princess Anne, it's just water, all right? Let's calm down. Mimi Newell, he suffers from diarrhea 4 to 5 times a week. He's already had a colonoscopy and it was clear. Okay, well, that's good. That's really, really good. Please help. Listen, Mimi, maybe he needs to be on some medication. So it is. Remember to bring your party to the water to the party. Absolutely. Pam, loving the topics on mental health issues during COVID. We can help dock out by discussing our own. Pam, that's a great idea. Why don't you share with me your experiences of life under lockdown, how it's impacted your mental health, how it's impacted your anxiety. What has it meant for you? How has it changed your life? Let me know your experiences. Put them in the comment section down below. And on Sunday, we will do an in-depth look at depression, how to identify depression, how to separate it from anxiety, what treatment is available, and how prevalent and how COVID-19 and isolation has had an impact on that. And I'll share your stories if you tell me by name in that clip. So let's round up today's fireside chat and virtual global clinic. We're going to go over to the premiere. We've got a fantastic pop. So remember to like, share, comment down below. Remember to hit the notification button. Stay safe. And I'll catch you all again in the premiere and on Friday at 9:30 Greenwich Mean Time. That's 1:30 Eastern, 4:30 Pacific. Till next time. Ciao, everybody. Take care. Bye-bye.